When you're given a diagnosis of cancer at any stage, at any point in your life, it's incredibly scary. And the information that is relevant to you and your specific diagnosis is not easy to find. So I think SOTERIA was born out of that need to really help people with that diagnosis and with the management of their disease. And the culture has really always been patient-focused. How can we serve this client and this patient at this time in the best way possible? What resources can we bring? What's the technology? We know about it, we've learned about it, and how can we distill all that down to apply it to that single individual with this incredibly scary diagnosis? When we think about cancer, and through time, through history, we realize that there's been a dramatic evolution in the way we think about it and we view the disease. If somebody had breast cancer, well, we would treat them the same as that next person that had breast cancer or the person before them that had breast cancer. We began to realize, as we sequenced more and more tumors, that lo and behold, every cancer was actually different. That if we looked at a cancer at the molecular level, at the different mutations, yes, there were commonalities and we could make some generalizations, but the truth is that every single patient with cancer had truly a different disease type. It was daunting at first because what that means is that we now really need to approach every patient as an individual. We can't group them together and say, if you've got lung cancer, you get A, B, and C. And now we're at a point where we're beginning to understand that not only is everybody's cancer different, but everybody's immune system is also different. And really now we need to bring those two fields of knowledge together to even further individualize therapy that's specific for an individual. SOTERIA really offers a critical tool to help patients with their diagnosis and with the management of their disease. SOTERIA can help navigate those initial diagnostic steps. What's the best molecular test to do? Is this a person who should be getting some sort of germline testing or not? How deeply do we need to sequence this tumor? Do we need to do any other testing? Do we need to look at their immune system, et cetera, et cetera? That could be the difference, literally, between somebody surviving their disease and succumbing to their disease. It's that important, it's that critical. We'll look back at this 5 years from now and we'll say, boy, I can't believe there was a day where we didn't get this testing on patients, where we didn't understand what mutations this person's cancer has. It'll be routine. SOTERIA fulfills an incredibly important role for every patient with a cancer diagnosis. Several years ago, we came up with an idea based on what we are learning about cancer and what we were learning about the immune system. And the fact that every individual cancer is really different, we had to begin to understand how an individual's immune system was responding to their cancer and begin to think about developing therapies based on that. The genesis of SOTERIA really is the technology that we can bring to bear to a person with a cancer diagnosis. Because it doesn't matter where they are geographically. It doesn't matter where they're being seen. It doesn't matter what their diagnosis is. Every cancer patient really deserves this type of analysis of their tumor. It goes beyond how much it costs and what a person's socioeconomic status is. This is really should be as basic as what their cancer looks like under the microscope, the pathology. It should be as basic as getting a scan. The reason I really enjoy working with SOTERIA is that they can bring things to the table that might otherwise be inaccessible to patients or at the very least difficult to get. And SOTERIA does the legwork. They go to the effort to collect the specimens, to put together the analyses, to make sure that things are happening and flowing and not getting stuck somewhere. And then, of course, they deliver the data in a package that for the patient is easy to understand. They go through it with the patient and And so these can be very sophisticated tests that even oncologists don't understand, but SOTERIA drills down on the important aspects of it and tells the patient what it means, and also provides that information, of course, for the treating physician. I have all the information I can obtain about this patient's cancer, and I can bring it together to design the best possible therapies. As an oncologist, as a treating physician, that's not only incredibly satisfying, but I feel like I'm doing the best job I possibly can for that individual. And that's what it's all about. One other aspect of SOTERIA, you get the feeling that for them, it's not just a job. This is, it's not just a company. This is really a mission. This is an attempt to change the way patients are treated, patients are diagnosed, and the way the cancer journey runs. And granted, the outcome may not be great all the time, but in the meantime, the people at SOTERIA are going to make sure that they're going to apply the best possible technology, the best possible data, the best possible treatments are going to come to that patient. And really, when you talk to them, it's not a matter of I'm doing this because it's my job. It's really I'm doing this because this is what I love to do. And working with people like that is incredibly satisfying.